Welcome back. The FDA has approved the first postpartum depression pills for mothers.
This is a big development, and joining us this morning to talk about it is with Sunbeam mental health therapist Kaydee Norton. Kaydee, thanks for talking to us this morning. We appreciate it. Thanks for joining us.
Yes, my pleasure.
Oh, wonderful. Talk to us first off about, this is a big development for anyone suffering from postpartum. What do folks need to know heading into this of whether to get this type of treatment? What are some things that people should consider?
Yeah, so perinatal mood and anxiety disorder can affect about 1 in 7 birthing persons, and also the silent sufferer, the fathers and the partners of the birthing is about 1 in 10. So this is a really big thing to be able to have some medication and some help for those people who are suffering. That way they don't have to suffer in silence.
You were telling me before that this, folks are faced with not only depression, they've kind of redefined some of what people face after giving pregnancy.
Yeah, it's not only depressive symptoms that people can experience. We can also see anxiety, some obsessive compulsive symptoms, and even psychosis as well.
How can it affect children? We talk about it with the mom. How does it affect baby?
Yeah, so when a mom is experiencing these symptoms, a lot of times they find they're not as into being a mother. They're having some feelings of shame and guilt, not finding pleasure, and that can affect the baby with the attachment and bonding that is going on. It's so vital those first few weeks and months of life. And so you don't see immediate things, but something that can happen later on in life. Some mothers can experience that more extreme psychosis and can find thoughts and feelings of wanting to harm themselves and babies. So that's where it can be really, really impactful to have those interventions early on.
Okay, this new pill is called Zuranolone. That's my best guess at how to pronounce this new pill. I'm sure we'll be hearing all about it. To kind of talk about not treating is kind of what you touched on and what it can lead to, and why you should really get treated for postpartum, whatever your option is, as quickly as possible.
Yeah, we don't want mothers to suffer, especially suffer in silence. We all know motherhood is so stressful at the beginning anyway, and we have lots of big ups and downs with our emotions. And so being able to get help very soon is going to allow mom to re-regulate and to be able to begin that bonding process. Like I said, some of the things that we kind of want to look out for, like I mentioned, is that, first of all, something just feels off. There's newness. Having a baby, you're gonna feel off in general, but you know yourself, and if something's not right, that's kind of the first step to talk to your healthcare provider, whether that be your physician or a lactation consultant or your mental health professional. Also looking at those feelings of just overwhelmingly sad weepiness that just isn't going away, feelings of just loss of hope and loss of joy of things that you used to really find joyful.
Pay attention to your body and what's happening. Wonderful.
Kaydee Norton with Sunbeam, thank you so much for being here with us this morning.
Thank you, Kaydee.
I appreciate it.